My Lord, it's a pleasure to follow the very important speech of the Noble Lady Baroness Gohier, and her words reflect what I was hearing last night at a meeting with the Justice for Windrush generations, where there was reflections that minoritised communities share the experience of inequality and discrimination, but the individual experience of different communities is different and needs to be acknowledged. Now, I thank the Noble Lady Baroness Taylor of Bradford for securing this debate, and also for reminding me of a meeting I attended in Huddersfield in 2016, which was 480 people stretched across 2 meeting rooms with hundreds of people outside unable to get into the room. That was the Hands Off Huddersfield Royal Infirmary campaign. And I note, actually, in looking around today, there's a book just out, Fighting from the Heart by Cormac Kelly, that recounts that campaign. And that's going to pick up one of the themes of my speech, which is we've been focusing absolutely rightly on listening to individual patients, but we also need to listen to communities and the demands that communities make of their maternity services. And I think Huddersfield Royal Infirmary, the case of what's happened there, is a real example of that. Now, I'm perhaps quite unusual in this debate in that I neither bring personal experience or professional experience. So I put the topic out around the Green Party to collect people's views and experiences. And one of the ones that came back that shocked me a little bit, and I'm going to anonymise this because I'm referring to a member of staff, but this member of staff reflected on her personal experience. A professional woman in London, you would expect well-equipped to navigate through the system. But her experience was that she didn't have the nice recommended number of antenatal appointments, and as a result of that, a serious issue was missed. Now, that, I think, reflects on an individual level what we're hearing from all of the Royal Colleges, etc., about the inadequacy of services and all the statistics. And coming back to the community point, a Green Party Birkenhead and Tranmere councillor, Amanda Onwurmane, who is herself a former midwife, drew my attention to the current perilous situation of the Liverpool Women's Hospital, which is threatened with closure. The alternative accommodation and services that are being proposed do not match that are being lost in maternity and other services. And the NHS and the women of Merseyside are being shortchanged again. Now, I want to look at what's happening there because it's a reflection of something we haven't talked about very much. The issue of PFI, private finance initiatives, the privatisation of the NHS, and how that has cut away at resources, and that's reflected in what's happening in Liverpool in other places. And the concern is that a particularly quality service is at risk of being lost. And that also reflects what, again, is happening in London, where the NHS North Central London is consulting on the potential of closing one of 2 maternity services in London hospitals due to fewer births. These are the Whittington and the Royal Free. Now, if someone from outside London looks at a map, and you might look at those 2 and think, well, they're not too very far apart. But anyone who knows this area, and I do well from previous political campaigning, will know that the public transport provision across, heading east-west across London, is extremely poor. People can frequently have to take 3 different buses to get from the east of what's the Whittington's catchment area to the Royal Free. And people need local services, and that's something that really must not be lost. And I quote Mayani Muthuvello from the Whittington Maternity and Neonatal Voices, who told BBC London that there's a real sense of reassurance of giving birth in a hospital near to where family and friends live, and that travelling to a facility further away adds to pressure on patients. So what we're seeing is not just the overall quality of service issues, but an issue of loss of local services. And I think it's worth contrasting this with looking at the government's own words in commenting this month on the Women's Health Strategy for England. And that's focused on expanding women's health hubs It's focused on, indeed, it rightly says, focused on maternity care, continuing to deliver the NHS England's 3-year delivery plan for maternity and neonatal services. And so the government has plans for this, but we're really not seeing the kind of outcomes, as we've heard from so many other noble lords, that we were actually desperately needing. And I do want to pick up the points that the noble lady Baroness Gohere said, because the figures are really deeply shocking. And these are grouped figures because those are the figures that the NHS provides, but I'm relying in part on the briefing from the Royal College of Obstetricians and Gynaecologists. Women from black ethnic backgrounds were 3 times more likely to die during or up to 6 weeks after pregnancy, and Asian women twice as likely. And deaths from mental health-related causes, as many noble lords have highlighted, it would count for nearly 40% of the deaths occurring within the year of an end of pregnancy. And a direct question here for the noble lord, the Minister, as the Royal College is calling for, will the government commit to a time-limited target to reduce maternal inequalities, to drive the innovation, improvement and, crucially, investment that's needed in these areas? Now, I want to pick up a point, briefly pick up a point made by the noble lady Baroness Watkins, because I think it is terribly important. There is no doubt that the serious major issues we're seeing in the outcomes of maternity services reflects more broadly the poor level of public health across our entire population. And this is where I run into the Green Party problem, is that everything's related to everything else. When you bring systems thinking in, you need to talk about everything and think about everything. But if we're talking about maternal health, we have to talk about things like people's working hours, people's commuting time. Are people able to work from home? Do people get the breaks and the kind of working conditions that they need to have a healthy pregnancy, a healthy birth, and provide healthy care for their baby? And just looking around these issues, I was looking at a really interesting study from the University of Swansea about how counterintuitively, during the pandemic, the biggest period of lockdown to the pandemic, when there was actually real shortages in the provision of services, probably unavoidably, but actually they found in Wales that rates of breastfeeding and levels of breastfeeding, successful breastfeeding, length of wet breastfeeding, actually went up. And this is where we need to look at that social setting, that if people are able to work from home, if people are at home, if people have less commuting time, they're able to spend more time with a newborn, then you actually end up with healthier outcomes. And we all know, whilst we have to acknowledge that breastfeeding cannot and will not work for everybody, the health outcomes are crucial to encourage that as much as we can for both mothers and babies. Now, I'm sure pretty well all noble lords have received the predictable, perhaps, but important flood of briefings before this debate. Mumsnet, the Royal College of Midwives, the Royal College of Obstetrician and Gynaecologists that I've already referred to, Baby Lifeline, SANS, and the Care Quality Commission its own. And what they all stress is the huge problems with the workforce, particularly people not being trained, people having to be trained under conditions of extreme debt, and of course the number of people leaving the professions, particularly that of midwives. And I'm reminded of a trainee midwife who I spoke to just as the change was being made that midwives would be found loaded down with debt, would be paying for their own training. Now, she was, as is often the case, doing a second degree. She'd done one degree, had worked, had a couple of children, and decided to retrain as a midwife. And she was speaking about her own experience of being a trainee midwife in a birth suite where, tragically, there had been an unexpected stillbirth. And it happened that all of the fully qualified professionals in that room were occupied with medical things. And she found herself comforting the mother who had just had an unexpected stillbirth. Now, I find it obscene that people are having to now pay fees to be doing something like that as they're completing their training. I don't think that's acceptable. Now, just some more on that debt point. 3/4 of the student midwives, and this is from the Royal College of Midwives briefing, 3/4 of the student midwives in England surveyed expect to graduate with debts of more than £40,000. Just 1% expect to graduate with less than £5,000 of debt. And about half, 47% of all student midwives in England have a job outside their training in order to earn money. And that job is unexpectedly having a negative impact on their training. That cannot be acceptable. That cannot be setting people up for a long time, secure, stable career in midwifery. And of course, what we're seeing, and I'm referring here to the Sands briefing, who quotes a midwife, what we're seeing is that the lack of staff puts more pressure on the existing staff, and then more people leave, then the lack of staff puts more pressure on. And I want to quote the words here: staff are frightened to work in an understaffed, under-resourced unit for fear of mistakes or incidents occurring due to the high level of activity and understaffing, fear of investigations as a consequence, and fear for their mental health and well-being as a result. This is what we are doing to our midwives. And just one financial point, drawing on the Mumsnet briefing. The fact is that the government paid out £2.6 billion in the past year as a result of failures in the NHS in maternity and neonatal care. It's costing us enormously, and it's costing us financially. And I just want to circle back to my initial point about the importance of local facilities and women's facilities and listening to communities. I looked up historic England, thinking about the situation in Liverpool, and the first women's hospitals appeared in the 1840s, and there were 12 by 1871. Many people may know of the site, no longer there, of the Elizabeth Garrett Anderson founding the new London Hospital for Women on the Euston Road. We've been through a cycle, several cycles. We had, in early modern times, female midwives that, by the standards of the time, provided good quality of care. We then saw the arrival of male midwives that actually saw more deaths. We then saw, in Victorian times, the upswelling of women's services. We're now at risk of losing them again. This is a cycle we need to break.